The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. So excited we're here. It's the second week in February, getting ready to record. You'll probably be hearing this episode in March. Got a fantastic doctor on the program today. He's going to really tackle some problems that dentists are facing. Can't wait to get him going. So let's just start. Dr. Bryan Laskin, say hello to everyone.
Hello, everyone, and thank you so much for having me here. Very much appreciate it. I love your perspective of bite-sized information for dentists. So thanks for doing what you do for the industry.
Yeah, appreciate that. So let's just, first question, we ask this for so many people. How'd you become a dentist? How'd you get involved in dentistry?
Well, unlike a lot of dentists, I did not know what I wanted to do when I graduated from college. I was going to be a physician and went on rounds with some family members who are physicians and quickly realized that wasn't for me. But I wanted to do something in healthcare, wanted to do something with my hands and really help people every day. And that's how I got started. So I went and basically went around with people in healthcare, realized that dentists were very calm people traditionally. And I'm not. I'm very high energy. Let's put it in a nice way, ADD. And I thought that this would calm me down. Well, that was flawed logic, but I'm very glad. I love the dental profession and found my niche, but I'm not, and I didn't have a traditional path. I don't even have a filling in my mouth. Well, that's not totally true. I didn't have a filling in my mouth until after I was a dentist. So didn't know anything about dentistry when I went into it.
Yeah. We're going to jump into a little bit of a solution that you have for dentists and toothapps. But before we do, let me ask you this question. What are some problems that you were facing yourself and that you face in your practice, you see other dentists facing and that they're calling you about seeking help with?
Traditionally, there's been one overarching theme through my career and through the other dentists. I've worked with thousands of dentists. It's people, right? It's team members specifically is what people I think find is the biggest challenge. And since COVID, obviously that has been amplified and heightened like never before. So finding and retaining top talent, right? Specifically right now at this moment in time, I think maintaining profitability is becoming a bigger challenge than most dentists probably even realize right now, but there probably will be soon because everything has gone up in price and especially wages. And we don't have the same type of pricing flexibility across the entire industry, particularly if you participate in insurance. And then I would layer another third one on top of that, which is meeting people's expectations. The expectations that our patients have in healthcare providers coming out of the global pandemic has been heightened. I could go down any number of ways, but if you walk around planet Earth in the year 2023, people have expectations on what interacting with any business is, and we're lagging behind in healthcare and specifically in dentistry. So those are the big three things. I think one that has and always will be an issue is retaining talent, finding and retaining talent. But right now, profitability and meeting patients' expectations, I think, are kind of under the microscope, so to speak.
Yeah, and those are three big things, right? I mean, those are huge, right? I mean, they're all obviously tied together. Let's talk about level of service a little bit. And you talked about what people are expecting. I think people's expectations right now are at all-time lows for most industries and what they're getting for service. We've gotten used to longer wait times. Restaurant service is, except for five-star steakhouses, in my opinion, is terrible. Right, the takeout service is terrible. Store checkouts are longer than ever. Seems to be a real labor shortage going on out there, and it seems to be declining service. I think in the restaurant business and in certain industries like that we're going to actually see a revolt. People are going to go, well, if I'm not going to get great service, I'm not going out anymore. Right, and they're going to actually pull back, and that'll change in the restaurant industry. Do you see it changing in healthcare kind of like that too, or do you think it just needs to continue to move up and move onward?
Well, you brought up a great point that I hadn't thought about, which is the people's expectations are lowered due to the just poor service that everywhere gets everybody. But so when I was talking about the patient experience, I'm talking more about exactly. We're in alignment, but you sort of put a nuance in it that I hadn't thought about, which is the drop in customer service across the board. Like, I just met with the team at my dental practice, which is in a whole nother building. I'm not there very often, but we were like, guess who has problems with team members? Everybody on planet Earth right now, right?
Right.
So, however, what I mean is the conveniences that people would expect. So, for example, do people have to call you to set an appointment, right? That's not done today. When you go to that 5-star steakhouse, you don't call them anymore. You go online and make a reservation, right?
100%.
If you want to pay your bill, you should be able to do that online. Those types of conveniences, which are different than customer service. But I do agree with you that there's been this sort of recalibration of like, okay, customer service is horrible everywhere. So there's been a lowering in expectations on the human to human. That doesn't mean we should succumb to it, right? But what I'm saying is from a operational perspective, having like, in what other industry do they say, oh, by the way, your car needs to be fixed? We won't get to it for 2 months. Now that might happen, but it still frustrates you, right?
Oh yeah, it's horrible.
So I think it's really, as much as possible, people can go on Amazon. I ordered something from Amazon yesterday, and my door rang at the office, and it was a thing that I ordered like a couple hours ago. Right?
Yeah.
That recalibrates people's expectations, right?
Yep, 100%. I going to the car dealership thing a bit ago. Oh, actually, even backing up to like people doing things online. There's the closest Chipotle to my office. You have to order food on your app, on their app. There's no place to order food inside the restaurant whatsoever. That's it. If you want to pay cash, sorry. If you want to order from a person, we don't have that option or that availability. Or at least it was that way for quite some time. I stopped going in because of it. It's just annoying, but that is coming in. And what you mentioned about car dealerships. Here's what happens is your car dealership might tell you it's 3 weeks. And I ran, month-old truck about 2-3 months ago. Window wouldn't roll down. First time I hit roll up. First time I hit the back window down, it wouldn't go back up. Called the dealer. They said, 3 weeks. I'm like, what? I'm online checking out other dealers, trying to find which dealer I can get into next, because I'm not waiting 3 weeks on a new car. That's happening in dentistry and healthcare, isn't it? People aren't going to wait 3 to 4 weeks like they used to. Do you agree with that, or do you think I'm wrong?
Oh, couldn't agree more. And that's the thing that people miss is that I think in dentistry, they're thinking, well, I think there's a K-shaped curve that's going on right now. And what that means is that practices are doing this or they're doing that. And for the bulk of my 20-year career, well, a little more than 20 years, I'm trying to make myself younger than I am. There was a very small standard deviation between practices. One might grow 15%, another one 12%. So you're doing better, but it's that standard of deviation is becoming so much larger because there's practices that are adjusting to the patient's expectations and ones that aren't. And people are making them. It's not just employees that are making a massive shift, it's patients also. And by the way, those two things are correlated, right? So if you have the type of practice that's creating conveniences for patients, guess what? Like you said with checking online, or the office that's convenient for patients is also convenient for team members, right? Your front desk, the people at your front desk, they're not furniture, right? The people on your business team aren't looking to process people's paperwork all day long. That's not why they want to work at a dental practice. Right?
Sure.
So forcing them to do that boring, mundane, laborious task is just going to have them leave the practice and have your patients leave the practice too.
Right.
So there was a study that said that 1/3 of patients in healthcare are switching healthcare offices due to the poor digital experience, right? And that's going on in dentistry. And I think a lot of practices don't even realize it because they're just busy doing high quality care for their patients, and they don't pay attention to the patient's digital experience, which is a huge, huge, huge factor in their healthcare today.
Yeah, I truly believe right now that, and for most, not all practices, but for many practices, if the dentists want to maintain, and this is practices where they have a full, if they're a month out or they have a full caseload right now, that if the dentist wants to maintain their net income, their personal income, they're going to have to use automation or outsourcing to help cut the amount of employees that they need so that they can pay the great employees the type of money that they're going to need to stick around. I'll just leave that as a statement. I want to back up a little bit to what you talked about as far as, being a great organization is a way to keep people. I think if everyone's listening to anyone who's listening to the show, if you had to ask yourself, would you rather work for $20 an hour? You have no choice. You're going to get paid $20 an hour. Do you want to work at McDonald's or Chick-fil-A? Everybody's raising their hand, right? Everybody's saying, I want to be at Chick-fil-A. It's a better organization as far as the service experience that the customers are getting, right? And I think the team members kind of show that. They look at uniforms are neat, they're clean, the whole experience is fantastic. And I think it makes people want to work there over someplace that's not so awesome. So let's get into toothapps a little bit. So I know that's kind of the direction that we're heading here with some of these features that can help out a practice. Tell me what toothapps is and what it does for practices.
Well, thanks. So toothapps it's like the Google Play Store or the Apple App Store for dentistry. So you can think about it like this. I believe that there's some broken things in technology. So backtracking, I sold my dental practices 4 years ago to a DSO, to a large group. And at that time, I had developed and was scaling a product called OperaDDS, which was a patient communication solution. And it was in 20,000 offices plus when I sold that a year and a half ago. And OperaDDS was a collection of features like what we're talking about now that deburdens the dental practice and basically solving problems in my own practices to make it convenient for team members and for patients. Now, after selling that product, one of the primary reasons why I sold that company was to focus on a broader issue that I saw in dentistry, which is the lack of innovation and the lack of data accessibility for patients and for dental practices. If you think about it, if you move from Oklahoma to New York, in my opinion, you should be able to push a button, have all of your dental records, which are yours as a patient legally, transferred to that new dentist, right? So what we're doing with toothapps is we're calling what we call connected dentistry. We're connecting all of your dental data, both wherever it lives, for a patient, for dental practices, so that if you want to choose, let's say you want to switch practice management softwares, it should be the push of a button, because it's not the practice management system's data. It is your patient's data legally and yours to manage. That has been completely blocked in dentistry, which is now illegal due to some regulation that's been passed in 2016 called the Cures Act. And the information blocking rule, which was passed in October 6th of last year, or went into effect October 6th of last year. So ultimately what we're doing is we're democratizing how innovation works in dentistry. So that if you have an application that's innovative in dentistry, we plug it into toothapps. You can have all of your applications with a single login, and we have what we call a fully integrated calendar. So you have your EagleSoft calendar, right? And your Google calendar, your HIPAA training calendar, your billing, all in one convenient, intuitive space that you can run from your mobile phone.
Sure. It sounds fantastic.
I threw a lot at you there.
Yeah, you did. And I think our audience needs to check out your site. First, go to bryanlaskin.com. You can get the toothapps there. You can read the patient manifesto. I think there's some great content they can find on there. Let's talk about cost for a little bit, right? So we haven't,
Sure.
And I'm not going to ask you what it costs, because what it costs doesn't matter. What does it save a dentist, or how can it enable them to make more money? So what are some easy ways that it helps pay for itself and deliver a return on investment for those that are interested? Great
Question. There's a software tax on dentistry that I think dentists intuitively know they're paying, right?
Yeah, sure.
So just to enlighten maybe you, but certainly the audience, every application that you attach to your practice management software pays a separate fee to that practice management software. And in the case of the largest practice management software, that's about $50 an office. So if you pay $100 for per month for a software application, $50 of that $100 goes directly to the practice management software to get the data that is your patient's and yours, not the practice management softwares.
Sure.
And so one of the things we're doing is we're getting rid of that. At toothapps, the software vendors pay a percentage, which is half the cost of like the Apple App Store. And so right there, if you use 4 different applications, we're saving, that dental practice is saving, there's not $200 going directly to the practice management software.
Sure.
And then in addition to that, the way that most practice management softwares work is they partner with the software vendors that either they own a large part of or are very big to the point where they can just make so much money off them from just charging all these offices. Where at toothapps, our barrier is, are you HIPAA compliant? Are you PCI compliant if you're doing charging? We're opening the door for more innovation. Because if you have, like I've talked with 2 different innovative companies, one, an AI chart note writer, and another one that's doing AI design for labs, right? And these companies are having a hard time getting into the larger groups. But if you wanted to automate your chart notes, right, that's competitive with the practice management software. But we can save you hours and hours of exactly what we're talking about. Writing your charts as a dentist is a massive PIA. Right.
Yeah.
But you'll never see that directly within a practice management software unless they can charge you too much for it. Right. Versus us, we want to provide all of these innovative solutions, and you just get to choose whatever is best for you at that moment in time. And if you want to select something else, if you want to switch from OperaDDS forms to toothapps forms, it's just a push of a button, and there's no IT, no integration. One login, one bill. And so the number of ways that you save is massive because we're basically unrestricting the anti-competitive monopolistic behavior that's kind of going on in the software space in dentistry today.
Yeah, makes sense to me. I want to encourage our audience one more time. Check out the website, bryanlaskin.com. Great information, keynotes in there, your book. You got to check that out. Learn more about toothapps. Dr. Laskin, thank you so much for coming on and sharing with us today. We really appreciate it.
Thank you very much. And thanks for having me. And just to clarify, my name is Bryan is with a Y. So BryanLaskin.com.
Perfect. Appreciate it. Yep. Thank you so much, Doctor.
Thank you.